Alright guys, it's Julian Calvin from Liver Health Centre, and today we'll be running through our tips and tricks for sciatica pain and lower back type pain. So for today, we'll sort of be running through what sciatica is, what it feels like for patients, and what we can sort of do and prescribe for them to help manage that. So for today, what is sciatica? Sciatica is essentially pain along any pathway or originating from the sciatic nerve. So essentially that nerve's come from touching the lower back into sort of that hip, gluteal region and down sort of that posterior leg. This pain can sort of feel sharp, mild, moderate to severe, and also radiating. Some patients may also sort of say that there's difficulties with walking and also muscular weaknesses. Additionally, some patients can report pins and needles sort of throughout their foot, leg, or any pathway along that sciatic nerve. The main causes of this is usually a herniated disc from the lower back or any sort of bony spurs that are sort of within the spinal column. Alright, so that's sort of sciatica. Now let's talk about some exercises we do to help alleviate sciatica type pain. The first one we'll be doing is stretching out the piriformis muscle and glute medius muscle. With these muscles sort of in close proximity around that hip region, freeing those off will sort of allow for a bit more mobility for that sciatic nerve. For this exercise, Cal, what I'll just get you to do, if we want to stretch out that left-sided piriformis muscle, I'll get you just to bring that left leg up for me, across the body just through here. Now there's a couple sort of ways we can do this stretch. The first one we sort of like to say is just getting them with their hands just to pull over that knee to the opposite shoulder. So Cal, I'll just get you to grab onto that knee for me, and now just bringing that to the opposite shoulder. We should be able to feel a localized stretch just sort of into this region. If that's not really getting much of a stretch for patients, we also sort of tell them to grab onto their opposite leg, so lifting this leg up, and then just pulling through there, like Cal's doing perfectly. For this stretch, we can sort of hold this for about 15 to 30 seconds. Also, don't forget to stretch both sides. Beautiful. Fantastic. Alrighty, the next exercise we'll sort of move on to now is a flossing exercise. So essentially what we sort of like to think with these ones, gliding, flossing, neural tension exercises, is if we think that the nerve is tethered from one end, sort of that brain spinal column, down the body into sort of where it terminates into sort of the foot for this sciatic nerve, an example. So what we essentially want to do is slide that nerve up, slide that nerve down, just to promote some more mobility for that particular nerve. What we'll do with this one is, Cal, I'll just get you to sort of bring up that leg for me. And as we sort of start to bring this hamstring to the foot up higher, we should start to feel a bit of a stretch through here. Can you feel that for me, Cal? Cal, I want you to hold that there. As that starts to come down, I want you to just lift your head and neck and shoulders just off the floor for me, all right? Beautiful. We'll go up and let's see if we can really get a nice stretch through there for you. Cool. And then as this comes down, that head, neck, and shoulders come back down. Beautiful. And just keep sort of bending that leg for me, all right? Keep doing that for me, a couple more goes. Beautiful. We're really sort of getting that movement from that head, pulling that nerve along and down. With this one, we can perform this about 8 to 10 times, have a break, and then perform about 2 to 3 sets of that. Alrighty, we'll now move on to a bit of more of a dynamic hamstring stretch, so really sort of freeing off that big hamstring muscle that's at the back of that thigh. So for this one, Cal, we'll just pop your leg just through this, your feet, sorry. Now from here, I'm just going to get you to hold on to this band, and I want you just to try and keep a straight knee if we can, and just pulling up that band, I really want you to try and lift that leg, and get a bit of a stretch just sort of through here. And now as you sort of lower your hand, and sort of just pull that down. And so this is a bit of an assisted stretch, but we want to sort of keep it moving, keep it nice and dynamic. Beautiful. About 8 to 10 repetitions of this one, and again, having a bit of a break and performing that about 2 to 3 times. Couple more for me, Cal. Fantastic. How's that feeling?
That's really good.
Good, lovely. Alrighty, last one. Beautiful. I'll take that one off your mat. Cheers. Alright. From this position now, we're going to move into pelvic tilts. So essentially what we sort of want to do here is we have a natural sort of curvature in our lumbar spine, the way Calvin's sitting at the moment. We want to try and enhance that and sort of bring that up and down. We'll bring our legs sort of a little bit closer to the body, in through here, and just about hip width apart, so slightly wider for me. Just get Cal just to sort of breathe in and out a couple times for me. We're really trying to get some breaths down into through here. Couple more. Try and get into that hand for me. Beautiful. Now with this one, Cal, I want you to really push your hips, push your heels into that ground, and as you sort of do that, your pelvis starts to sort of curl up towards you, alright? That's it. We can see it's just a small movement, and then you arches back the other way. We're only looking for about 1 inch off sort of that floor, okay? That's it. We can really sort of start to add in the breathing as well as we really sort of start to think about which direction we're going. So as you take a breath out, we really want to sort of draw that pelvis upwards off the ground, and then as we breath in, really curling it that other way. Again, same sort of rep range with this one, about 8 to 12 and sort of about 2 to 3 sets, okay? Beautiful. Next one from sort of this position again. Now we just bring our hips and our feet a little bit closer together. We really just want to work on now articulating the lumbar spine in sort of a left and right plane of motion. So now from here, we'll just get those knees driving. Just that motion of side to side for me. For this one, we don't want to see people coming too far where their shoulder starts to lift off. So it's really sort of localized to about that mid portion of that body where that lumbar spine starts to transition into the rest of the spine. Even just hanging out sort of into this spot for us, where we can just start to really feel a little bit of a stretch coming around the side of our body, and just holding that for about 5 seconds. Try to do that to the other side for me. Beautiful. And we can sort of repeat this motion about, again, 8 to 12 times, about 2 to 3 sets. From here, before we hop you up, we'll just get Cal to bring both those knees up towards the chest, and then with his hands, just really sort of getting onto those knees and pulling them down for us. This will work on sort of flattening out our lumbar spine. And we can hold this one for about 30 seconds. We won't let Cal do that though, because we've got a video to shoot, so we'll get him up. Cal, I'll get you just to roll over for me, so now just into sort of a 4-point kneeling position. Beautiful. So just from this position, we'll go knees a little bit wider, just sort of in line with your hips for me. Beautiful, that's fantastic. Now with this exercise, this is called the bird dog, and from here, we essentially really want to make sure we keep this spine nice and straight ahead. Imagine we've got a massive sort of dinner tray here full of food that we really don't want to spill. To sort of do this, we've got Cal already sort of in a bit of a nice sort of neutral position. Our back isn't too arched or anything like that. And just before we really get stuck into this exercise, we'll just sort of work one limb at a time. So Cal, just with your left arm for me, I'll get you just sort of reaching forwards as far as we can. And my hands just placed here just to make sure we aren't getting any shift or tilt. Coming back down for me, to that other side. Beautiful, we'll do this side again. We'll just do that about 2 more times. The other side. Fantastic, 1 more on each. And the other one. And back down. Now we'll try just with the legs. So with the legs, it's a little bit more difficult to stabilize through that lower back, but we'll just sort of see how Calvin goes here. So just starting with that left leg for me. Nice and long, we want length here. A little bit of a curve there, so we'll try and keep that nice and straight. That's it. Beautiful. And the other side. Alrighty, and 1 more on that side. Back down. Now we'll try and put this all together. So now it'll be a bit of a sort of coordination exercise where we're going to do opposites. So as I get you to do that left arm for me, I want that right leg to go as well, alright? Really sort of keeping nice and straight and long through here. Not too much curve there, beautiful. And the other side, ooh, a little bit there. Try and really hold those nice and still. That's it. And the other side. Nearly. Beautiful. Alrighty guys, that was our exercises on tips and tricks on how to sort of manage your sciatic pain. If you or anyone you know sort of does have this type of pain, please feel free to let us know. Liverpool Health Centre. Feel free to sort of give us a call and have a chat, alright? Thanks guys, bye.